Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Heart valve replacement. Introduction. Sometimes people have serious problems with the valves in their hearts. A heart valve repair or replacement surgery restores or replaces a defective heart valve. If your healthcare provider recommends a heart valve repair or replacement, the decision whether or not to have the procedure is yours. This program will help you understand the benefits and risks of this surgery. Anatomy. The heart is the most essential muscle in the body. Its main function is to pump the blood to the lungs and the rest of the body. The heart is formed by two main compartments: the right heart, the left heart. Each compartment has two chambers: a small chamber, called an atrium, a big chamber, called a ventricle. The ventricles are the main pumps of the heart. Blood comes from the body to the heart through two big veins. This blood enters the right atrium. It is then pumped into the right ventricle through a valve known as the tricuspid valve. The tricuspid valve has three flaps or cusps. The blood is then pumped into the lungs through the pulmonary valve. The blood is loaded with oxygen in the lungs. It then returns to the left side of the heart, to the left atrium. The blood is then pumped into the left ventricle through the mitral valve. The left ventricle pumps the blood to the rest of the body through the aortic valve. The valves have two functions: to allow the blood to flow through the heart smoothly, to prevent the blood from leaking back against the main flow, the way the valve in a bicycle pump allows air to flow through in only one direction. Symptoms and their causes. Valves are very delicate structures that can be damaged for a variety of reasons. The following diseases can result in valvular damage: inflammation of the valves, as seen in diseases such as rheumatic heart disease; infections of the valves, as seen in bacterial endocarditis; calcification and stiffness of the valves due to chronic or continual long-term wear and tear; defects from birth, also known as congenital malformations. These diseases can lead to two possible problems. In the first case, the damaged valve can have a smaller opening than the original valve. This is known as stenosis. With stenosis, the heart has to work much harder at pushing the blood through. Over time, this can cause a lot of strain on the heart and could even lead to death. In the second case, the heart valve may allow blood to flow backward. This is known as insufficiency. With insufficiency, the heart is less efficient at pumping blood to the body. This results in an increased workload, which could cause the heart to fail over time. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Alternative treatments. Medications can be used to help strengthen the heart and delay the need for an operation. Exercise and losing weight under your healthcare provider's supervision may help strengthen your heart. Stopping smoking if you smoke is essential to protect your heart. Valve repair or replacement is done when the damage starts to significantly affect the ability of the heart to function. Before the operation, you should visit your dentist to check for any infections. The presence of tooth or mouth infections at the time of the valve replacement procedure may increase your risk of infection after the procedure. Procedure. The valve can be repaired or replaced with a tissue valve or a mechanical valve. There are many different types of mechanical valves. Patients who use a mechanical valve must take blood thinners for the rest of their lives. Even though blood thinners are relatively safe, they do increase the risk of bleeding in the body. If this bleeding happens in the brain, it could lead to death. A mechanical valve can usually last for a lifetime. In extremely rare circumstances, the valve can malfunction and may need to be replaced. Tissue valves, taken from animals or human cadavers, have the advantage of not needing blood thinners, but they may get worn out over time and may need to be replaced every 10 to 15 years. Make sure to discuss the difference between the two types of valves with your healthcare providers. This operation is performed under general anesthesia, meaning that you will be asleep during the operation. The surgeon then opens your chest in the middle.
The breastbone is also opened in the middle so the surgeon can reach the heart. In some cases, only a few inches of the breastbone is cut. Sometimes one or more smaller incisions are made to the right of the breastbone. The bone is not cut. These incisions allow the surgeon to access the heart between the ribs using small instruments. The surgeon may use robotic arms to perform the operation.
At that time, special tubes are placed in the biggest veins and arteries of the body close to the heart. The blood is then rerouted from the heart to a heart-lung bypass machine, a special machine that pumps blood through the body and loads it with oxygen. This machine takes over the job of the heart and lungs while the heart is being worked on. The heart is then chemically stopped to allow the surgeon to operate on it. During that time, the blood is continuously circulated in the body and loaded with oxygen by the bypass machine. The damaged valve is then repaired or removed and a new valve sutured in place. When the repair or replacement is completed, the surgeon restarts the heart and the blood is allowed to go back through the heart again. Pacing wires are placed on the surface of the heart. In rare instances, these can be used to help restart the heart or control its rate. These wires are brought out through the skin and hooked to a machine called a pacer. This is usually temporary, and the wires are pulled out a few days later. Once the heart is restarted, the breastbone is then brought together and held with wire or a plate, and the chest incision is closed. Risks and complications. This surgery is very safe, but there are several possible risks and complications. These are unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks related to anesthesia and to rerouting the blood to the bypass machine during the surgery include arrhythmia or abnormal heartbeats, pneumonia, kidney failure, blood clots in the legs, strokes, death. These risks will be discussed with you in greater detail by your anesthesiologist or surgeon. Blood clots in the legs can happen. This usually shows up a few days after surgery. They can cause the leg to swell and hurt. These blood clots can get dislodged from the legs and go to the lungs, where they can cause shortness of breath, chest pain, and possibly death. Sometimes the shortness of breath can happen without warning. It is important to let your healthcare providers know if any of these symptoms happen. Getting out of bed shortly after surgery may help decrease the risks of this complication.
Some of the risks are seen in any type of surgery. These include 1. Infection, deep or at the skin level. Infections can involve the chest incision or incisions. Deep infections may involve the heart itself or the breastbone. Treating deep infections may require long-term antibiotics and possibly surgery to replace the valve.
2. Bleeding, either during or after the operation. This may require a blood transfusion.
3. Skin scars that may be painful or unsightly.
Other risks and complications are related specifically to this surgery. These are rare, but it is important to know about them. The repaired or replaced valve may rarely malfunction during, shortly after, or a long time after the operation. This may require an urgent surgery to replace the defective valve. Death may happen in rare cases. Abnormal heartbeats called arrhythmia may happen after surgery. These can be controlled by medications and are usually temporary. Rarely, this can be permanent, requiring medications for life. In some instances, a pacemaker may need to be placed.
Persistent pain from the breastbone cut is unlikely but possible.
The catheters can injure blood vessels in rare cases. After the surgery. When the operation is done, you will be transferred to the intensive care unit, or ICU. You may still be asleep and on the respirator. During the following day, you are allowed to wake up and you are eventually taken off the respirator. While on the respirator, you will be unable to speak. You will be kept comfortable with special sedatives. As soon as you are stable and off the respirator, you are transferred to a regular room to continue the recovery.
As you begin to move around in bed, your incisions may feel painful and sore, or you may feel pulling along the chest incision. These feelings may increase when you turn or cough.
Your nose and throat may be sore from having the breathing and stomach tube in. Lozenges and spray can help to ease this discomfort. A soft rubber tube that was inserted into your bladder during surgery is called a Foley catheter. This tube may make you feel like there is pressure in your bladder or that you have to urinate. In 1 to 2 days after surgery, when this tube is removed, you may feel burning the first few times you urinate. As you begin to take a more active role in your recovery, you may notice that your surgical incisions are sore, and there may be itching or numbness felt along them. You may also see bruising or slight redness around the area. This is part of the normal healing process and will disappear in time. Your wrist may be bruised and sore. This is because of a blood pressure monitoring catheter that was placed there during surgery. This too will improve in a few days.
When looking at your chest incision or incisions, you will see 2 small wires, called pacing wires. These are placed on each side of your incision, just below your rib cage.
These wires may be attached to a pacemaker to regulate your heart if needed. You will not be able to feel the wires attached to your heart, but you may feel the tape that is used to secure the wires to the skin. These wires will be removed before you leave the healthcare facility. You may also have some tubes draining excess fluid and air from around the lungs. These are known as chest tubes. You may feel a bit of a tug where they enter the chest, but they are not painful. They will also be taken out within a few days, depending on how much they are draining. Your muscles will feel weak and sore for some time after surgery. This will improve. You will then follow a cardiac rehabilitation program to allow a gradual transition back to usual daily activities. To decrease the chances of damage to the new valve, you should avoid smoking. Eat healthy and try to lose excess weight. Exercise regularly under your healthcare provider's supervision. You should tell your dentist and other healthcare providers that you have a prosthetic valve. You should take antibiotics before and after any dental work or invasive procedure to prevent possible infections. If you leave the healthcare facility on blood thinners such as Coumadin, you will be asked to have frequent blood tests to check on how thin your blood is. The healthcare provider usually looks at 2 values, the prothrombin time, or PT, and the INR number. These have to stay in a specific range. The dosage of Coumadin may have to be changed until the right dosage is reached. Once the right dosage is reached, you will still have to check your blood thinning level on a regular basis. Food rich in vitamin K could decrease the effectiveness of Coumadin. One of the main risks of blood thinners like Coumadin is life-threatening bleeding. Even after a minor accident, you may have to be checked by a healthcare provider for signs of bleeding that could lead to death. Check with your healthcare provider if you develop a severe headache. Headaches could result from bleeding in the brain. Report to your healthcare provider any unusual bleeding or any bleeding in your stools or urine. Dark and black stools may mean that you are bleeding in the intestines or stomach. Make sure to let your healthcare provider know about all of these and anything that is unusual or worrisome. Be sure to wear a medical alert bracelet stating that you are on blood thinners. Inform any new healthcare provider that you are on blood thinners. Some tests are dangerous when you are on this type of medication. Blood thinners may have to be stopped prior to these tests. If taken by a pregnant woman, this type of medication could result in birth defects. Many medications, including over-the-counter medications such as aspirin, can affect your blood thinners and possibly lead to serious bleeding consequences. Always ask your healthcare provider before taking any new medication.
Sternal precautions. If your breastbone was cut and closed with wire, the following sternal precautions will help you heal. If the breastbone was not cut or was closed with plating, ask your healthcare provider about your restrictions. To allow the bone to heal during the first 6 to 8 weeks after surgery, do not bend over, push or pull anything, reach, stretch or twist your chest, use your arms for support. Do not lift anything heavier than 5 to 10 pounds. Also, avoid placing both hands behind your neck or head. When you take deep breaths or cough, use a pillow to support and protect the incision. Firmly hold the pillow against your chest. Your healthcare providers will show you how to safely get into and out of a bed and a chair. Do not drive until your healthcare provider says it is okay.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Healthy heart valves are important for good blood circulation and for maintaining a healthy heart. Healthy valves keep the blood flowing and prevent the blood from backing up. Sometimes valves can be damaged, not allowing enough blood to flow through them or allowing blood to leak back against the flow. If this happens, you may need heart valve surgery to repair or replace a valve with either a mechanical valve or a tissue valve.
To allow the bone to heal during the first 6 to 8 weeks after surgery, do not bend over, push or pull anything, reach, stretch or twist your chest, use your arms for support.
Make sure to contact your healthcare provider in case of any new symptoms, such as chest pain, shortness of breath, weakness, swelling, infection, fever. Call your healthcare provider if you feel that your heart is beating too fast, too slow, or skipping beats. Valve surgery is relatively safe. Risks and complications are rare but possible. Knowing about them will help you detect them early if they happen. Thank you for using Explain.